Good afternoon, good evening. It is 8:16 p.m., April 18th, 2020. Weird times that we're in. So, this is a note to myself from myself. I figured this is kind of some strange times that we're in right now. We've never had this kind of a lockdown before. And I figured this would be a good opportunity for me to kind of write down some thoughts and just some other feelings I'm going through right now with this whole COVID-19 situation we're in. And usually, whenever I do these kind of podcasts, I like to have another guest with me. But due to the social physical distancing guidelines we have on right now, it's just me. So, hello, guest. I'm just actually there's a mirror on the wall. I'm just looking at myself, so it's kind of weird, but yeah, at least my guest is talking back to me too. But yeah, I just wanted to think back to this moment. Just I wonder what I'll be doing the next time this, whether it'll be a month from now, a year from now, a few years down the road. It's I don't know how we're going to look back on this. Like this, it really is a huge learning experience. I mean, so a lot of things that happened that I'll be honest, I didn't see coming. I didn't think toilet paper would be so expensive. I didn't think that cleaning supply, PPE, other personal protective equipment would skyrocket, and just all the sadness that's going on right now between it seems like every country in the world, every continent except Antarctica, because honestly, it's too cold to go down there anyway. So I don't blame no one for wanting to travel down that way. Yeah, I just wanted to think too, like what's interesting is as time's been going by for us in Canada here, things have just been ever more restrictive as times have gone by with kind of the rules we put in place, the social distancing guidelines and things like that. And it's very strange as time's going by. Like we're not seeing an end to what the final restrictions are going to be, and no one knows how long these restrictions are going to go in place for. It's interesting when you look at other countries. Is kind of one thing I like to do to kind of guess and see where we're going to be. I know it's impossible to replicate or to exactly hypothesize how Niagara is going to get through this just by looking at what some other provinces or what some other countries are doing. But I find it really valuable to at least try to learn from what other jurisdictions are doing in order to kind of battle this pandemic we're in, and to kind of learn and see what differences we have that make us either more protected in this time or more vulnerable. Like one thing we've all been seeing is how the denser places like New York City, where they have mass transit that I'm not sure the population, I think it's somewhere around 10 million across of all of New York City. All these people sharing a lot of the same infrastructure makes it that much easier for things to spread around there. I mean, we haven't been spared from that here in the Niagara region, but I know that's one thing that I'm, pretty happy about, that the regional transit's not, full in system. I guess they figured it would cost too much to have to put a subway system under the Welland Canal and along the river and whatnot. So I guess that's a positive to being in the Niagara region and having that, well, what seems like right now a slower growth rate. It's also interesting to look across and see what's happening over in Niagara County and Erie County. It's kind of crazy looking at Erie County. I haven't checked the numbers recently, but I remember there were certain points in time where there was about, I think, 10 times more cases across the river there than there were on our side of the river. And just kind of crazy to think that something like just having that river right there, that border, was able to kind of make it feel like we were on two separate battlegrounds in a way, that you had, the same enemy attacking both sides. Some people, they call it the invisible enemy. Yeah, pretty interesting. Just to it really is a big equalizer too. They keep saying how so many people are catching this. It doesn't matter, what your ethnicity is, what your nationality is, or even what your net was. How this really is affecting everyone. Obviously, there's certain areas that are hit a little bit harder. Think of different places, different neighborhoods that don't have the same public health infrastructure that other places do, or they don't have the same level of education. I mean, even just we're lucky to have the public service announcements that we're able to see, and think of all the education that's gone on over years to really try to protect us against this. I mean, obviously there's never enough that you can do to prepare for something like this, but it's crazy to see just how many people it can affect. I been looking at a few things that have been, I guess, a little bit encouraging. Seeing some of the numbers slowing down in countries that were really hard hit early on. Places like Italy, they've reached their peak number of cases that they've had per day, highest amounts, and we've seen some rays of sunshine there of some things slowing down. I mean, there's so many countries that were hard hit. I'm not going to play that game of trying to name it. Every single one that's been hurt, but I'm glad to see that some of those places are finally starting to see some signs of recovery, which we've all been really waiting to see. And the media is, it's tough. It's kind of it's amazing to have so many different sources of information, so many places to gather, and it's nice because you can visit a few different sites to kind of verify some things and see what what to make sure that there's real research being done across the board to verify like a lot of these different claims that are going on. There's so much information right now. I know I'm kind of just swapping around from topic to topic. I didn't know if I barely had anything prepared for this, so we'll just see where this goes. And I guess that kind of captures the whole feeling that I'm going through right now. Is just this never-ending cloud of different thoughts going through my head. And I feel like a lot of us are kind of going through this right now, where you just don't know what to think, don't know what to feel, so you just have to sit there and just wonder what's going to happen next. I forget where I heard this or read this. I mean, again, with the number of things that have been coming our way through social media, but I remember hearing this. It was, yeah, I can't even remember what it was I was going to say. Um, and that's again just the fear of all these different thoughts. Oh, I remember it now. So we feel helpless right now. There's nothing we really can do. Like it's not like we can get up and fight this beast off and try to push away this virus. It's not that. I mean, there's things we can do to prevent ourselves from getting it by just bolstering down. So we can't fight it. We can't run away from it either. We can't. It's not like there's one country in the world that is just completely protected from this. It has made its way, to every corner of the world except Antarctica, but some places that I still don't want to go to. Um, but it's just so we don't have fight or flight option right now. So the only other option we have is just to play dead and just sit still and hope that everything gets better soon. So, and like again, I am glad to see some signs of improvement in certain areas and some recovery happening. Even in New York State, they haven't reached nearly as many hospitalizations as they thought they were going to have before. And hopefully, we're able to finally get numbers down enough that are there's not that additional strain on the healthcare system. The one that I wanted to really talk about now is just, again, we've seen so many restrictions come into place. It just seems like every week there's a new announcement of a new set of businesses that can't be open, or new activities that can't be done. Restrictions just becoming ever and ever tighter. And yeah, obviously, I'm not against that. I know that restrictions are very important, and we must keep doing what we can to try to slow the spread of this pandemic and this virus. But it is really encouraging to see that the governments are already tilting towards being able to think about opening the economy and kind of obviously not getting back to normal life. I mean, there's no way we're going back to the way things were. Like that's an interesting thing, is to think about how we're going to be able to talk about how things were pre-COVID. Like yeah, I remember we used to sit on the subway, and there was no sanitation on board, and no one wore masks, and no one was wearing gloves. Oh yeah, those were pre-COVID days. Yeah, back in 2019, it was crazy. And so it's going to be interesting now. I wonder how many things are going to have to become touchless. Like even think of something like going into an elevator, how everyone that lives on the floor is going to be touching the same button every day when they go on and up and down their the building. Like I feel like they're going to have everything be voice command in public places like that, or maybe not voice command, but definitely touchless, to have more recognition systems in place to really try to stop as much contact as is necessary, really limit as much as you can. So one of the things that have come out this weekend actually are from the United States, right out of the White House. So they have put out a kind of guideline to all 50 states and the U.S. territories, is kind of a way to, based on what the CDC, the Center for Disease Control of the United States, has gathered for for their governors to reopen their economies. There's Trump's been ridiculous for a lot of different things when it comes to anything to do with this, and no one had a crystal ball, no one knew what was going to happen. There was definitely mistakes made. There was some. I mean, that's going to happen when things are moving as fast as they have been, and during this pandemic. But I am glad to see that with this guide that they put forward, by no means are they saying everyone open up as you feel. They are putting suggestions in place to ensure that we've had a few week proven record of recovery before we even think about doing anything like reopening for more people to go and shop and travel. So I just wanted to kind of go through this and explain afterwards how it would apply if our province took a similar approach to what is being laid down just south of the border. So, first off, before you could even think about progressing to any phases of opening your economy, there's certain things that have to be met, certain criteria that have to be met before even thinking about opening things up even a little bit. So, uh, what they want at first is for symptoms, there must be a downward trajectory of influenza like illnesses reported within a 14-day period and a downward trajectory of COVID-like syndromic cases reported within a 14-day period. So, of all types of flu, corona or not, they want to make sure that there's a proven record for 14 days of a decrease in the number of illnesses reported with either COVID-19 or with any other flu. And they want to make sure that hospitals are able to also treat anyone who needs to be treated, treat all patients without crisis care, and make sure that there is a robust testing program in place for at-risk healthcare workers, including emerging antibody testing. So make sure there's enough capacity to be able to test anyone that needs to be tested and to be able to help anyone that needs to be helped. And and just to, I guess, put this in perspective here. And again, I'm not a doctor. I'm not I have no PhD, no MD. My background's in economics, so I'm not. I'm a bit of a numbers guy, but by no means. I mean, this is just me reading off my computer right now. So do your own research. Don't. Oh, I mean, you can. I'll put the links on after, so you can read whatever I stumble on, and some of these words I might not be able to pronounce properly. We'll go along together anyways. So you need to have 2 weeks basically demonstrating that you've had a decrease in the spread of the disease, and also you must ensure that you have the right capacity to be able to handle anyone that wants to be tested and anyone who needs actual medical assistance. People who need to have that care. Those people that need to be in an ICU unit, or those that might eventually need a ventilator. Um, and also, so antibody testing, that's the interesting one they want to have on there. So antibody testing is to be able to, and I'm probably saying that funny, antibody testing. So to test if you have the antibodies within your bloodstream. And again, not a doctor, but I guess these are the little guys that are formed after you would have had COVID-19. And it's kind of the immune system's response is they create these antibodies in order to fight off certain infections. So it's kind of like how if you have a certain flu, you're less likely to get that flu that year, not until probably next year when it mutates into something that your antibodies aren't prepared to fight against. So once a state were to have like those 2 weeks of seeing a decrease in the number of cases, then that's when they can progress over to phase one. And the nice thing is there is a little guide on here, some simple things like make sure that you're always washing your hands, make sure that you're still through every phase practicing regular physical distancing. And so you are for sure are going to be permanent. There's going to be a lot of different policies that are going to be in place, well, perhaps forever. I mean, things that should have been in place anyways, and that were in place, just not. You don't put a sign on every building when you walk in to make sure that you wash your hands every day, or every time that you need to, every time you go to the bathroom, or I guess anytime you sneeze. So that's something that I think there's going to be a lot more public service announcements for these days. I remember when I was really young, Ontario used to have these PSAs that were just like at the time they're horrible. I mean, you'd almost sing along with them. The one like, "Don't you put it in your mouth." There's going to be a lot of those. There's going to be a huge comeback in public service announcements. So get ready for that. Um, So yeah, I just want to kind of walk on down here to what phase one is. So again, phase one, this is after you're able to actually have 2 weeks where you're not showing an increase in your um, like cases per day. The rate of increase is slowing down. The risk of spread is lower for 2 weeks straight, and your hospitals are able to test anyone that needs to be tested, and anyone that needs to have medical attention is able to get that. Then you can move on to phase one of reopening the economy, reopening the country or the state, I guess. Or this could eventually be any jurisdiction might go with some sort of a version of these guidelines. So within that first 2 week period, so technically speaking, like if things were to start going down right now, this would be 2 weeks from now. You'd be able to start seeing phase one executed in certain state. So for phase one, you must still have all vulnerable individuals should continue to shelter in place. Members of households with vulnerable residents should be aware that by return to work or other environments where distancing is not practical, they could carry the virus back home. So they're still saying be very cautious within this period. 2 weeks in doesn't mean that they're going to be better. They know that there could still be a risk of spread. There's still people that are infected in the population at this time. So they're not allowing, people to just go complete willy-nilly yet. This is going to, again, this is the three-phase system here. And of course, there's going to be certain things that are permanent after this, but let's see what else they have for phase one. So all individuals, when publics, parks, outdoor recreation settings of more than 10 people where appropriate distancing may not be practical should be avoided unless precautionary measures are observed. So in Ontario, they for quite a while have had it 5 or less people. And of course, they recommend, the less people you see, that absolutely the better. But I know that 5 people has been a maximum for quite a while across the province. So that's interesting to see that the White House, the CDC guidelines for all states to follow. Not obviously, it's not mandatory, but it is what they're recommending based on their research for all of the 50 states. But that's interesting. Already 2 weeks after to have groups of 10, you'll see as these phases progress, that number goes up. But kind of like it's hard to even think about having something with 10 or more people right now. It's yeah, like I just you'd be a criminal if you were to do something like that right now, and in some cases you actually would be held accountable for a certain fine. And also in this phase one, you must still minimize non-essential travel and adhere to the CDC guidelines regarding isolation following travel. So, for example, here, how you still have to stay in place for 2 weeks upon returning to Canada within phase one. So 14 weeks or 14 days after having a decrease of cases and having the capacity to help anyone who needs to be helped, then you should still not fly if you don't have to. Try to just stay put still within it. It's so when you're 2 weeks in, you're nowhere close to the finish line. You're okay, not to say nowhere close. You're still quite a bit away. You still got at least 2 phases to go based on what the CDC are saying. For employers, they want people to continue to encourage to telework, so everyone still work from home if possible, and yeah, whenever possible, and with business operations. If possible, return to work in phases. So what they're suggesting here is don't just have everyone. I imagine, let's say for an office of 100 people, don't just ship all 100 people back on a Monday morning and say, all right, everyone, like back to work, teleworking's done. If you're already able to have operations from home, let's say if you're a company that does, let's say you're a call center and you've got 100 people and it costs a little bit more to have them to work from home. Maybe you need to get like a separate mobile phone for each person in the short term during this time, but it costs less to get them in the office. Don't just say, okay, because now we're going to have all 100 back right now. Try to maybe have, I guess, 10 people come in every week until we eventually get to the point where we have all 100. Because the thing is with these guidelines is I'm sure that if you have an increase of cases, it's pretty much like playing snakes and ladders. Like you're gonna move quite a way back. Like I imagine you go right back to phase one if you saw an increase, that you've got to wait another 2 week period before you can start to have any kind of lift of restrictions. So that's why employers want to be taking people back in as slow as possible, according to the CDC. Common areas should still be closed. So things like cafeterias, or if there's common training rooms, things like that, there really shouldn't be any place to, I guess, congregate for the first little while after coming back, according to the CDC. Minimize non-essential travel. So Again, try with businesses. I guess that would probably mean like don't hold as many meetings anything that could be done over the phone, just do over the phone or over Zoom. Or I guess Zoom is really bad and everyone gets hacked. Skype, whatever is best. I'm not sponsored by anyone or any online service, so just use whatever. Just be careful, have multiple passwords and all that jazz. Um, yeah, and strongly consider special accommodations for people who are members of vulnerable populations. So employers to please do the best they can to make sure that um, they're not putting anyone at risk by putting them back in the workplace too soon. If there's still a way to keep them locked up, not okay. That sounds bad. Keep at home for longer. Don't lock them in. That's probably illegal. And there's a list here of other specific employers and certain guidelines for them within that phase one period. Schools and organized youth activities, daycare camp that are currently closed should remain closed still within 2 weeks after. So just to compare, today is April 18th. If we were to go 2 weeks ahead from now, that would be, I think, May 1st. Just doing my quick math in my head. I don't, okay, where's my calendar? Yeah, I believe that'd be May 2nd. So, yeah, 2 weeks from now, if we were to see a decrease, schools would still be closed. If we were to go with these guidelines, again, Ontario could be completely different. But if we were following what has been released from the United States, from the White House, and visits to senior living facilities and hospitals should still be prohibited during this period. Large venues can operate under strict physical distancing protocols. So they haven't, in this release to the public, shown what that means, what strict physical distancing is. But they're saying large venues, which include sit-down dining, movie theaters, sporting venues, places of worship. These can all actually. All right, I'm just going to put this link too right in the comments section. So anyone who's watching live, just take a look at that, and you can follow along with me on here. And just so you know, I'm not making any of this stuff up. I'm just reading what I found in the States. And if we do follow what they have laid out by the CDC, at least we'll have a little bit of time to, I guess, prepare and digest what is possible. Again, none of this could be just be completely different. Doug Ford could take a completely different approach, but just kind of to let us hypothesize what might happen here. So within this period, though, it's crazy that it does say sit-down dining, movie theaters, sporting venues, places of worship can operate under strict physical distancing protocols. And this makes me think there must be many other documents that go directly to the governments in order to kind of help them formulate what these plans are going to be. I'm not sure if there are any states that would be within that phase one period yet. I know Washington State, Oregon, and actually most of the West Coast, I think even California, but I could be wrong, kind of had an early hit, and they've been slowing down quite considerably. And they've been spared, especially when you compare them to New York State. And we'll get into those numbers in a bit. I have the coronavirus tracker state by state from the New York Times. Another link I'll have to plop in the comment section after. But yeah, so that's crazy that large venues. I'm curious what those strict protocol will be in that 2 week zone after. I can't see that being very easy to do here. Like I feel like we might still need another 2 weeks after. And they're gonna learn. They're gonna, some states are probably gonna take it really easy and say, yeah, you know what, come on in. We're just gonna try to space tables a little bit, and we'll just, I guess, this is all we've been doing, and all we can do is just wait and see how it goes in other states with different policies, and then we'll determine from there if that's something that we're able to follow, or you might end up finding out that one state opened up their bars and restaurants too soon, and then before you know it, we're moving a few weeks back. So I guess it's good to see that there are some other states that have been through the fight a little bit sooner, have gone through a lot of these challenges sooner, and we're going to really be able to learn a lot and hopefully implement the best plan possible from learning from our neighbors down south. Gyms can open if they adhere to strict physical distancing and sanitation protocols. I don't think I'm going to be going to a public gym for a long time. I mean, I'm not that lazy. I do like to work out mostly at home. I was paranoid of going to gyms before anyways. Just, it's not even like the germs really. It's just the sweat of other people. Like no one's perfect for cleaning up. Like I don't know. I feel like I can't see myself going to like just a regular like a typical like just gym. Like I could see myself still going to like other programs and whatnot, things that that there's a lot of a lot of, I guess, like sanitation or minimal contact of machines and whatnot. But yeah, that's one thing. There's definitely going to be a lot more investment in sanitation for businesses. Elective surgeries, so they can resume as clinically appropriate on an outpatient basis at facilities that adhere to CMS guidelines. So elective surgeries at that point, 2 weeks after the peak, would be able to start. But the thing is that they're going to just basically have to make sure that there is enough capacity for that. Like, how can you imagine if they allowed people to start? I don't know, like let's say, I mean, my nose is crooked. So let's say they let people like me come in and start straightening our noses, and we're taking up all the hospital beds when people need them. That could be a catastrophe. So I will not be going for a rhinoplasty anytime soon. I don't want to be in a hospital if I don't have to be. God bless you, anyone who's working in a hospital. That I know that these frontline workers are going through a hell of a lot, and having to deal with this invisible enemy every day is got to be just very stressful. I mean, I have a few friends who are nurses. Shout out to the nurses out there. My aunt Tony's a nurse. God bless her for going out to work every day. And yeah, so bars remain closed during this period. But it's funny how restaurants can. I feel like they're going to have to clean that up. There's no way they can say that, just because most bars, for sure in Canada, I know every bar has to actually serve food with it as well. So I mean, every bar really is a restaurant. So it'll be interesting to see how that really goes. I can't see that happening here probably for another 4 weeks after the peak is hit. So we'll just wait and see what we learn from our friends down south, and see what we implement here. So on to phase two. So again, this is when you have done that exact same 2 week period without having an increase of cases again. So basically saying that you have a 4 week period where you're seeing a decrease in the amount of daily spread of increases of cases. So within this phase two, this 4 weeks after, so 4 weeks from today, we're talking about May 15th. So halfway through May, we could hypothetically be up to this. In this phase, all individuals should continue to shelter in place. So still recommending, don't be just going out dancing around like we normally would before. Members of households with vulnerable residents should be aware that by returning to work, so same kind of cautions that we're seeing to make sure that at least avoid going near anyone who really could be hurt. Like what I'm kind of seeing here is the key to all this is just really making sure we protect our most vulnerable. So those with immune systems that are diminished, or those who might be a little more elderly, those who have pre-existing conditions. So that's a ongoing theme here throughout every phase, is to make sure that we keep our distance from those who can receive the most harm from this virus. So what's interesting though, in phase two, 4 weeks from now, hypothetically, all individuals when in public should maximize physical distance from others. So still try to keep away from people. And yeah, social settings of more than 50 where appropriate distancing may not be practical should be avoided unless precautionary measures are observed. So 4 weeks from now, that's when you can have things up to 50 people in events, which I don't think people are going to be right to do that. Those that are running out and eager to go have groups of 50 plus people, please stay away from me for a little while. I'm probably not going to any huge events for the next little while. I'm just going to be locked in here with the camera and with the microphone and all that. What's interesting is non-essential travel can resume after that 4 week mark, because is like wondering how long it'll be until it's okay for people to go on vacation. Here's just like a quick thought experiment. If I were to leave right now and somehow I got out of the country, I got over the border and I went for vacation somewhere, like, how horrible it'd be. Let's say I go back and visit some family right now in Italy. I don't know, I take a boat, I get there, I'm there for a week and I make my way back. Everyone's going to want to stay even farther. 6 feet's not going to be close. It's going to be 6 kilometers away from me when I come back. And so obviously, like, that's not a good thing to be doing. Like, it's a reason why you're not allowed to go over the border right now, is that you can't spread to other places and bring spread from other places back here. So, but who knows, in 4 weeks, I don't think people are going to be wanting to go away. I think, like, I still would be afraid to bring it back and to scare people, to, potentially bring spread back. So I think it's going to be a lot longer than 4 weeks before we see a lot of non-essential travel. Obviously, our tourism industries and many other industries that rely on heavier transportation, they would love to see the non-essential travel bounce back, but the reality is, I think a lot of people are going to be paranoid of going on planes and going on long journeys in the short term. Hopefully, we can return back to not the word normal's thrown out the window, but go back to or I keep saying go back, get to a time where we're able to again enjoy traveling and going to different places. But I don't think that we're going to be jumping to do that in 4 weeks. Employers at this point, 4 weeks in, continue to encourage telework. So that's one thing is a lot of businesses for sure are going to be teleworking a lot more than they were previously. I think there's a lot of positions that could have been working from home for a very long time but haven't just because the investments weren't made and just because if things have worked a certain way and they're not broken, why fix them? But now with that investment, with that ability for people to work remotely, I think we're going to be seeing a lot more of that for a long time. Might kind of fade off after a little while. People might start returning naturally just from there being less presence of the virus. Perhaps if there being a vaccine coming, then people will feel less fearful. But I think this, even with the vaccine, this really is still a wake up call for a lot of people. And I think there's going to be that fear of another virus could always be around the corner. I mean, it's interesting going back to even thinking in December how we had our plans for what was going to be happening in March and April of 2020, and how those plans have changed. That we didn't see them coming, and the next virus could be the exact same way. Something that just one day isn't there and the next day is. So I think that people are still going to want to be able to have that ability to bunker down. There's going to be a lot more investment in things like stocking up on toilet paper and investing on staying off the grid. People like gardening is one thing that's been huge right now. A lot of people have been investing in buying chickens, buying other things that they can grow from home. I mean, you're going to probably see a lot more home farming after this. I know some councils have had to have fights with people to determine whether they're allowed to have chickens within certain boundaries or not. I think this is going to be a big battle that is around the corner of a lot of people who don't want to go to the grocery store as much as they have to, and will try to farm anything that they would normally want to buy in a package. Still close common areas where possible during this 4 week period. Strongly consider special accommodations. So still do what you can to keep the vulnerable at home if possible. Specific types of employers. So schools can reopen during this period, 4 weeks in. Visits to senior care facilities should still be prohibited, and visits to hospitals in that time. So they're still saying, and at that point, it's been 4 weeks with decreases in the trends, but still they're saying you shouldn't have people coming to visit yet within that phase. So just to expect, we're going to have probably at least 4 weeks until we can start visiting people in senior care facilities and hospitals. Elective surgeries can resume as clinically appropriate, outpatient and inpatient basis at facilities that adhere to CMS guidelines. So after 4 weeks, non-elective surgeries can begin again. So another 4 weeks until get my nose job. Just kidding. Gyms can remain open. So again, they can already open under very strict guidelines for sanitation. And now they changed the word, adhere to strict physical distancing and sanitation protocols. So okay, I think it's the next phase is when all of a sudden the wording really changes and it's kind of just like, make sure it's not dirty. Bars at this point may operate with diminished standing room occupancy where applicable and appropriate. So what I imagine seeing is some sort of a situation 4 weeks from now. So again, this could be by mid-May if we continue to see a downward trend here. It'll have to be a downward trend Ontario-wide in order for us to have those Ontario restrictions lifted. But yeah, so it could be 4 weeks from now if we continue to see a downward trend. Now phase 3, so this is when you are 6 weeks, so a month and a half really, with a decrease in the number of cases, and still in that capacity to help anyone who needs to help and test anyone that wants to be tested, or I guess needs to be tested. So individuals at this point can resume public interaction, but should practice physical distancing. So still, this phase really is kind of the last one before we return to, or again, I don't want to say return to, we go back and then not go back, but go to some new time where we are going to live as normal as we can, but with without the scars and these memories that we've have ingrained in us. So, anyways, 6 weeks down the road, we can resume these interactions, but still practice physical distancing, minimize exposure to social settings where distancing may not be practical unless precautionary measures are observed. So, wear a bag everywhere you go, I guess, or just wear a big bubble. Low risk populations should consider minimizing time spent in crowded environments. So they're still saying it's still out there at this point. A lot less, obviously, to be 6 weeks with a decrease in cases, but at that point, people who are high risk really should be vulnerable citizens. Really should do what they can to stay home. And yeah, low risk populations, they should still decrease the amount of time they're spending out there if possible. Employers resume unrestricted staffing of work sites. So this is where it's kind of like, okay, like I guess at the 6 week mark, they're just like, whatever you want, employers. um there's going to be more restrictions to come, I'm sure, and they're going to be learning that not every industry is going to be the same. Not every industry is going to be able to return back on the same day. So kind of surprising to see such little wording on that piece. Specific types of employers. So point, weeks of the decrease, visits to senior care facilities and hospitals can resume. So that is, for a lot of people, that is very encouraging to see that there is going to be that point, 6 weeks from the peak of cases growing, that you'll be able to finally visit those loved ones in the senior care facilities. And I haven't been able to see my grandma or my grandpa. It's probably been, I want to say, yeah, it was beginning of March. So, it feels like forever, I guess a month and a half since I got to see them. And so that's, it could be another month and a half, assuming the best case scenario is when I'll be able to, visit them in a safe way. At that point, large venues, so sit down dining, movie theaters, sporting venues, places of worship, they can operate under limited physical distancing protocols. So that is, so interesting still, that even 6 weeks later on, there's still going to be some strict physical distancing protocols, or sorry, limited at that point. So it goes from strict to limited. So there's still going to be some. My thought was this. Now, movie theaters, let's say a movie theater can sit normally 100 people when it's absolutely full, if they could sell every ticket. But now we're going to have to space out our movie theaters. Now imagine that they need to take away every other seat in the movie theater. So now there's only 50 seats left in there, approximately 50 seats after they space everything out. Everyone's got twice as much room in order to reduce the spread, so there's not people bumping elbows anymore. What'll be interesting is that means that if they were to sell out every seat, no matter what, before and after, before they were able to sell 100 tickets, now they can only sell 50 tickets. So they're getting half the revenue if it were the same price charge. Let's say it was $10 in order to see a movie. Now that there's only half as many people in there, if they want to have that same amount of revenue, they're going to have to charge $20 each per seat. But I think people who are still wanting to go to the movie theater, so those that are really diehard to go see movies, they're probably going to be willing to pay even twice as much to still go. I'm talking to people like my brother who are absolute diehards, who when a new Avengers movie comes out, he has to go the night that it comes out, no matter what. These kind of people are still going to be paying, whatever the rate is, twice the rate to go see these movies. And I think it's going to have to be kind of a tilt towards those movie theaters being a little more luxurious in order to be able to justify selling those tickets for a higher price. So I could see something like that happening for a lot of sporting venues, which is unfortunate because, it's going to be less affordable to be able to go to a movie venue, but you're not going to be able to go the same way that you're able to before, going to a sports game, going to a concert. It's going to be so different now. Places are going to have to really reconfigure their seating. Everything's going to have to be a little more spaced apart. Things are going to have to be a little more expensive. Or, a lot of these industries, for sure, they're not going to be able to sell out. They'll feel there's going to be so many people that would rather watch from home now. Think of how many people probably invested in brand new TVs now. I'd love to see the numbers of people that went and before all this started, or even during, ordered, sent to their house, bought new TVs, new sound systems, where they thought, hey, usually I like to go to a sports game once a month, or go to a comedy club once a month, or go to any public venue once a month. But they say, you know what, like I can't go a month without being immersed in that experience. So they buy these big TVs. These people now, even when the restrictions are lifted, they're not going to be running back to the movie theaters. A lot of these people are going to be paranoid, and a lot of these people are going to say, I already invested in this huge TV. I may as well just sit home and watch the game here now that I have it. Plus, it's in some cases like, well, I already spent a few $1,000s on my sound system and TV and new couch and everything else, so I don't have the money to go back to watching in the movie theater for a while. I put a big investment in now to save me money from ever going to the movie theater again. So that's something I can really see happening. Unfortunately, I'm really hoping not. And I think that these companies are the ones that are able to innovate and maybe cater to this, this more sanitary conscious, like people that are more germophobic. Like, you're going to have to be able to adapt to this new clientele, this new consumer base that has been, affected so much by COVID. So I just want to go back and take a look at some of the numbers across the different states. It is just insane how one country could have such a different on which corner of the country you're at. Um, New York State, 236,000 cases today on April 18th, 2020, looking at 8:57 p.m. And I know New York State has a lot of people too, so you have to look at this on a per capita basis. So look at 17 cases per 100,000 people. And then it's interesting to go down to, let's see, Wyoming here, 305 cases in total. Okay, Wyoming's a way smaller population. So let's do this on a per capita basis. Hawaii, well, okay, that makes sense. Hawaii is, they don't have borders. They're out in the middle of the ocean. It's just a few little islands in Hawaii, so they were able to close off quite well. Minnesota, very successful as well at minimizing the damage. Only 39 cases per 100,000. I mean, still are still horrible for every person that had to have those cases, and especially for those that lost their life due to this. But it's just, I'm so thankful to see our numbers a lot lower here in Ontario and Canada and the Niagara region. So in the Niagara region, we've had 364 cases as of right now, again, April 18th. And just trying to see how many cases we had today. I believe 13 cases today, if I'm reading this right, or if it's okay, it's not loading. I know that, yesterday, I believe it was, we had 31 new cases. So, I mean, I know we're a small population here, about 450,000 from the last census for the Niagara region. That's that decrease from yesterday, at least. I know that sounds over. Today it was only 13 new cases compared to, I believe, was 31 on the 16th. There we go. Now it's loading. Yeah, 31 on the 17th and 13 today. So quite a lot less today of new cases, but it's tough to be able to look at these numbers and to project a line of where we're going to be in a week or two, because there's so many real world factors that are constantly changing. Even something as simple as increasing the number of places that we test and the number of tests that we do is going to change how these charts end up reporting. And then it's interesting looking across the country too. What's really encouraging is the number of cases that we reported on the 17th in Canada was 1,821 cases. Today was much lower at 1,456. So again, going with those CDC, Centers for Disease Control of the United States guidelines, hypothetically speaking, from this highest increase of cases in Canada of 1821 on the 17th, it could be 2 weeks from yesterday. So from Friday, 2 weeks ahead, we could be at that phase one kind of approach. So, I just want to kind of say this is a way for us to, keep our heads up and know that even though we definitely still have a fight ahead of us here, at least another 6 weeks until we can really start to ease up to a level, I think that'll be similar to where we've been in the past. But obviously with a lot of new differences, at least it's encouraging to see that, it looks like some of these distancing measures that we put in place are starting to show a bit of an impact. In Ontario yesterday, 564 cases, today 485. So it was another peak in the total number of new cases, but we are moving down. Today compared to yesterday. Let's hope that trend continues. So it's now 9 p.m. So I guess I should finish my coffee because caffeine not too good. So I'll probably be up for another few hours. Luckily tomorrow's Sunday, so I can sleep in anyways. But yeah, I'm really glad I got to sit down and do this. I'm so excited to be able to have these podcasts again when I can actually have guests to join me. But for right now, I'll just action, and I've had enough of looking at me in the mirror. So I just want to thank anyone who tuned into this. And Dan, a month from now, a year from now, a decade from now, who knows how long I will have YouTube and all this saved for. And hopefully, hope you enjoyed this too, to see where we were at on April 18th around 8 to 9 p.m. 2020. And let's see, I'm just going to put one more on the comments. I think that might just actually end when it ends. The comments go away. Oh well, have a good one, guys. Thanks for tuning in. Bye.